Good evening, class. Today we'll be discussing employee burnout, or as titled, Consequence of Employee Burnout. To begin, burnout is defined as the prolonged state of mental, physical, and emotional exhaustion. Burnout has stages and steps. A person does not just wake up one day burnt out. It slowly builds, and if not managed properly, leads to a burnt out individual. There are three categories of effects: psychological, physical, and professional, each manifesting in different ways, such as depression, heart disease, and absenteeism. In worsening cases, even suicidal thoughts, feelings, and actions. 85% of employees have experienced at least one of these categories of effects. Employee burnout has many causes, examples being excessive work stress, unmanaged work stress, being unappreciated at work, and having a terrible work-life balance, as well as being treated unfairly at work. Each of these examples on their own would be enough to begin the burnout process, but when an employee suffers from multiple of these examples, the process speeds up and the effects worsen. Burnout can manifest in multiple ways. To categorize them, we will use actions and health. Burnout actions can be anything from excessive calling outs, negative rhetoric, job hunting, to even physical harm. Burnout health manifestations can be anxiety, depression, diabetes, hypertension, high blood pressure, heart disease, and even self-destructive thoughts. Burnout has 4 effects on work performance: missing deadlines, reduced quality of work, increased turnover, and reduced innovation. Each of these are valuable to a job, so these effects influence whether an employee is capable and willing to do their job. Managers should care. These effects on performance can lead to a company's quality of work and in turn their customers to decrease. One employee being burnt out will not bring a company down, but the contagiousness of burnout will eventually lead to a large number of employees being affected and either leaving or bringing the company's quality of work down with them. There are things that managers can do to curb burnout: checking in with employees, engaging their happiness and health, lessening employees' workload to be more manageable, providing resources for an employee's mental, emotional, and physical health, encouraging employees to take time off to recharge and enjoy life outside of work, and finally, providing a work-life balance by not disturbing employees before or after work or during their time off. Employees can deal with burnout by taking time off of work, prioritizing their health and personal life. Employees can also deal with burnout by having a healthy work-life balance and a healthy manager-employee relationship, allowing the employee to have a professional and personal relationship with their work and manager. To conclude, burnout is contagious and can be felt in any work field, from doctors and lawyers to field workers. No one is immune to it. Burnout affects a person's mental, physical, and emotional state. To ensure the health of the employees and productivity of work, employees and managers must work together to effectively manage burnout. Thank you.